Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we are celebrating a very special occasion, the 10th anniversary of the opening of Novant Health Brunswick Medical Center. We'll talk with Shelburne Stevens, president of Novant Health's Coastal Market. Then we will welcome Lori Whalen, president of Novant Health Brunswick Medical Center. And finally, we will be joined by Jill Ward, Novant Health Brunswick Medical Center's Chief Nursing Officer. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Shelburne Stevens of Novant Health's Coastal Market. Welcome back to the show again, Shelburne. It's so good to have you here.
It's good to be here, June.
Yeah, it seems like every once in a while we have to do this. We have to get together and have these little chats. But I understand you have some very exciting news for me today, right?
That's right. I always have good news for you.
Yeah, you do. Some of it's better than others, but most of it's fun anyway. Well, tell me about it. Congratulations.
Well, thank you. I have a new title since the last time I did the show with you. So I'm now the president of New Hanover Regional Medical Center and the Novant Health Coastal Market.
That's a mouthful.
It is a large title, isn't it?
It is a big title, yes. So, well, how's it going so far?
It's going really well. It's only been a month that we've been into it, and but things are going well. I still have oversight of Brunswick Medical Center as well as Pender and Cape Fear Hospital as well.
My goodness, that is a big job. And
It's good.
I know the folks at Brunswick Medical Center were sad, but I know that they're as happy as I am for you. It's a wonderful opportunity, and
Well, thank
we
you.
wish you the best. Well, today we're going to kind of take a look back because I can't believe it, 10 years since we opened that hospital. So I wanted to take a walk down memory lane.
Sure.
How's that? Now, I know you were at the old facility, as was I. So let's talk about the differences between the old Brunswick Community Hospital and the new Novant Health Brunswick Medical Center.
Well, the obvious thing is the size.
Yeah, obviously.
We only had about 70,000 square feet at the old hospital. It was all on one floor, and
Right.
everyone saw each other every day. And
That's true.
now we're about 270,000 square feet, and departments are spread out over about 4 floors. And so you don't get to see everybody every day like you once did, but the team has gotten used to that over the years. And the old hospital, you had semi-private rooms, and it's all private rooms at the new hospital now.
And bathrooms.
Yep, everybody has their own bathroom and shower, and just large rooms as well, so plenty of room
Yeah.
for your guests and family to come see
They're
you.
really nice. That was one thing that I do miss is because we did know everyone, and you didn't meet someone that you didn't know, you didn't run into anyone. But I think we've adapted well. And when I was there today rounding, I saw so many people that I hadn't seen in a while, but still we know each other, and it's more like family than.
It is. That community hospital feel has not gone away just
No.
because it's
The
larger.
size didn't affect the community hospital feel.
No.
So, yeah, I'm really happy about that. Well, I know that we moved patients and equipment and people and during that time. But tell me a little bit about how that occurred.
So it took a lot.
Yeah.
We actually hired an outside company to help us with the planning and the staging and the actual move. So the planning started about 8 months before the actual move. And then in a series of about 10 days, they moved everything, and they helped us line up with local sheriff's department and EMS and other transport agencies to move equipment as well as patients. And by
Some of those patients were so excited.
They were. They all wanted to be the first one in the new facility. And we had little gifts for them as they came into the new hospital. But we started at 6 o'clock in the morning.
I remember.
And we were done with the patients around 9 a.m. They were all in their new rooms.
New beds.
Yeah.
All new furniture.
Yeah.
It was very foggy that morning. Remember that?
It was foggy that morning. I do remember it.
Terrible. It was terrible. It was so early in the morning, but I can remember the day before we moved, somebody didn't want to go home. They didn't want to be discharged.
Yes.
Because they wanted to spend the night in the new facility.
They did.
No, that was pretty funny. But is there anything during that move that surprised you or stood out?
No, just the excitement and enthusiasm about the move. And it was a well-oiled process.
Mm-hmm.
And, we couldn't have two emergency departments open at the same time, so we had to stop services at one, open them up at the next. So it was a very staged approach to it. But just the enthusiasm from the team and the providers, and as you said, the patients.
They were so excited.
They were. And then moving to the new facility, we had the dining on call where you could call and order what you want. And they had their private rooms and private baths. We had a little problem getting some people out. They wanted to stay a few more days.
They wanted to lengthen their stay.
They did.
That's a good problem to have. Let's talk about accomplishments. What are you most proud of during those first 10 years at the new facility?
Gosh, it's going to be hard to narrow that down.
There's too many.
I would say overall it's just the growth of the facility.
Yeah.
When we first opened up, there was a couple of halls. We didn't open those doors.
That's right.
We didn't have the volume to do that. And today, we're struggling every day. We don't have enough beds, and we're holding people in the ED. So been able to recruit a lot of providers to the area, the use of telemedicine for those specialties that we don't have, adding a Da Vinci robot. Not many community hospitals.
Now the second one.
Not many community hospitals have those. Celebrating a few years ago, delivering 500 babies at 1 year was a big one. So it's just how much it's grown and how much we've improved the quality and safety. And we've been a Leapfrog A hospital for a long time now, and that's really hard to achieve. But the team continues to knock that out of the ballpark.
Yeah. It's funny when I remember giving a tour at the old facility and saying we delivered 9 babies a month.
Yes.
And now it's like 50. So it's not just a golf community or a retirement community anymore. There's lots of young folks here. Another thing we probably should talk about are hurricanes. It's hurricane season, so you've had some experience at that. That last one was a doozy.
Yes.
So talk to me about that, how you prepare for that.
So we have a well-written plan. The staff know it inside and out, and we start planning a few days before the storm hits, and then we have a team that stays there during the duration of the storm, and everyone sleeps on site. During Florence, I had a blow-up mattress and stayed in my office for 6 nights. But it's really a lot of teamwork. It's not that busy during the storm. And then once the storm passes and everyone can make it safely home, then another team comes in to take over. And that was the problem with Florence, is we had all the flooding, so it was several days before they could leave. But the team just really rallies together and does a great job to take care of the community during those storms. And we could easily close and say we're evacuating and not be here, but it's part of our mission to take care of the community, so we're going to be here during those storms.
Right. We treat everybody like family, as we treat each other.
That's right.
Like family, so you don't leave your family in times of crisis.
No, and we've had to stay there a few times in some ice storms years ago too, so
that's
just
true.
The opposite.
That's true. Well, let's talk about the future. What are you most excited about in terms of Novant Health and their future here and all over the place?
So now we're a large market here with the purchasing of New Hanover Regional Medical Center. And the good thing about that is being able to keep patients local, whether it's here at Brunswick or Pender. We got the certificate of need approval for the hospital in Scotts Hill, so we'll start that build next year. And so having specialists available, whether it's boots on the ground here at Brunswick or telemedicine to keep patients local, and then New Hanover is going to be there for that tertiary or quaternary care for the really sick patients.
Right.
Today they're full hold-in patients, and we send them a lot. We might only have one specialist in that specialty, and so they have to go up there. And I know several cases stayed in the emergency department up there for 2 days and then was discharged from there. So really just growing the services, and I see in the future building on to Brunswick Medical Center for more beds to keep up with the population growth that's occurring here. We're really going to be able to meet the needs of the community locally, so that folks don't have to drive that long distance, and grow services with the partnership with UNC. We're growing
that's amazing.
Yeah, we're growing the residency program. We're going to be growing pediatrics to be able to provide more services so folks don't have to go inland to a Chapel Hill or a Duke. But those great facilities are there for some of those services, burn centers that we don't offer, and some of those things. But really, it's just exciting to sit back and think about, look at what we're going to be able to bring to the community and the people of Southeast North Carolina.
Right.
And it's just really, really exciting. And also keep a focus on our not-for-profit mission. We still have that very robust charity care policy that really improved what New Hanover had. And it helps so many people. A family of 4 who has a household income of less than $78,000 and they don't have any insurance, they're not going to get a bill from Novant.
That is truly amazing.
It is.
I just had a conversation with somebody about that yesterday, and the fact that it's better now than it was for New Hanover, it's just amazing. So, well, thank you so much for coming today. It's always a pleasure to have you. Sometimes we laugh more, sometimes we but yeah, I'm so excited for you, and the best of luck. We wish you all the best at New Hanover. And
I'll be back.
You're not going to forget us. You're going to be back.
I'll be back. Talk about all the growth I just talked about.
Because you're over the whole market now.
That's right.
That's right. Okay, well, come back and see us.
I'll do that.
Thanks. Now, let's welcome Lori Whalen, President of Novant Health Brunswick Medical Center. Lori, happy to have you here. I'm so excited.
I'm excited.
It's your first time on the show.
It is. I'm very excited to be here, June, so thank you for having me.
Oh, you're quite welcome. Tell me your new position.
Sure. So as of May 1st, my new position is President and COO of Novant Health Brunswick Medical Center. But with the recent partnership with New Hanover Regional Medical Center and the development of the Novant Health Coastal Market, I will also have regional responsibilities for services such as imaging, pharmacy and lab, as well as neurosciences and oncology services.
That's a big job, Lori.
It is, but I'm looking forward to it.
First, congratulations.
Thank you.
We're so happy to have you. I think you're going to do a great job. You had big shoes to fill.
I know.
But I think that you are up to the job.
Thank you very much. I'm looking forward
I know
to
the
it.
staff is really excited, and I've heard so many great things about you already. You're so friendly, and you're out and about. They're getting to know you, so it's off to a great start.
Well, thank you. It's been a smooth transition. I will say the Novant Health team, as well as Brunswick Medical Center team and physicians have really just welcomed me with open arms.
That's awesome. Well, let's get to know you a little bit. Tell me about your background and your education.
Sure. So I graduated from UNCW, go Seahawks, with a BS in marine biology. And then after that, I went on to receive my Doctor of Pharmacy from Campbell University.
Wow. So you're a pharmacist?
I am. I'm a pharmacist.
I'll be darned. That's great. Are you originally from this area?
I am not originally from this area. So I'm originally from New Jersey. But I did come down here to go into UNCW, and I've been here for over 24 years now, so I really consider this area home.
Yeah, me too. We've been here 23 years, and I consider this home now.
Me too.
But I don't think you're ever a local. I mean, unless
That's
you
what
grew
I
up
hear.
here,
Yep.
you're never really a local. But, oh well, that's okay. We can still enjoy
We'll
it
still
here,
claim
right?
it.
So, I know you love it here. What do you love most about living in this area?
Well, I mean, I think what drew me here was just the sheer beauty of the region.
Oh, it is
but
beautiful.
I think what's kept me here is just really the people and the community. It's a big area and it's a big town, but it's a close-knit, tight community,
is.
and that's what's really kept me here.
Yeah, I like that small town feel. And Shelburne and I were talking about how even though we've grown from that little hospital to the one we have now, we still feel like family.
Absolutely.
We still know all the people, and I'm hoping that we'll be able to keep that community hometown feel with the addition of New Hanover Regional Medical Center, which we're thrilled about.
Absolutely.
They'll just become part of our family.
Agree. I think that is the one thing that really showed throughout this process was that our cultures were so aligned.
They are so aligned.
And while New Hanover is a big place, we still consider ourselves family as well. And so now we're just part of the big Novant family.
That's right. I know that having received treatment at New Hanover, you do treat your patients like family. You've treated my husband and myself, and it's just like being home.
That's true.
They do a great job. Well, we're coming up on 10 years in our facility, and we're having some sort of a celebration. So will you all be celebrating with us, the folks at New Hanover? Is it going to be one big celebration, or?
Well, of course. So we've got a human experience team that is planning all of the festivities. And so we look forward to a lot of celebrations the week of July 19th through the 25th. So I think more information to come, but we're looking forward to celebrating this milestone.
Oh, awesome. That'll be one big party. Talk to me about the pandemic. How's your staff fared with the pandemic?
Well, I mean, I will just say that I've been consistently amazed at really just the grace and the resiliency that our teams have shown, and just the perseverance, and also really how the community has wrapped their arms around our staff, because they truly are heroes. And now as an organization, I think our biggest focus is making sure we can prevent their burnout and really focus on their resiliency, because it has been a tough year for all.
Yeah, it certainly has for everyone. As you think about the next 10 years, what do you see?
Oh, I mean, I think what I'm most excited about is really just continuing to develop and provide the high quality, remarkable health care to the community in Brunswick County, but also to the region. And I think we really look forward to bringing the much needed services close to home and really doing it in an equitable way so that we reach all of our community members.
Yes.
That's what I'm most looking forward to.
This county is so broad. It just goes way beyond this Charlotte supply area. So it's difficult to reach some of those folks.
It is. And we have to meet people where they are. And we have to provide the services they need at the time they need it.
Yes, you're absolutely right. So do you expect to see continued growth through the partnership of Novant Health and New Hanover Regional Medical Center?
Oh, absolutely. I mean, the growth in this area is just astonishing. And as you know, I mean, our challenge is really going to be keeping up with that growth and making sure that we can continue to be proactive so that we can provide the much needed access across the region and the entire coastal market.
And that includes getting new doctors.
Absolutely.
We need several new doctors.
We've done some what we call physician manpower studies, and it shows significant growth that we need in this region. And so we're currently working on plans to make sure that we can meet those growth needs.
Yeah, I love the fact that we'll be able to add specialties in this area based on the physicians coming to support us from New Hanover Regional Medical Center, because we don't have everything here. But between the two of us, we pretty much can do it all.
Absolutely.
And now that we're one, it's just so much easier. It makes so much sense. I wish it happened sooner.
Agree. But I think being able to keep patients locally and being able to provide those services, there's no reason why we can't provide it in this region and provide the highest level of quality that you could get anywhere else.
Anywhere else, that's right. No longer do you have to travel to inland.
Yes, we won't even say the words.
We won't even say the words, no. Well, that's great information. It's been wonderful having you. Good to meet you. Before we wrap up, would you like to share anything else?
Just really that I am thrilled to be part of the Novant Health family and thrilled to be part of Brunswick Medical Center, and really want, if there's anything anyone needs or suggestions on how we can improve our services, that please contact me at any time.
That's awesome. Thank you so much.
Absolutely.
I hope you'll come back real soon.
I absolutely will. Thank you for having me, June.
You're welcome. finally, let's welcome Jill Ward, Novant Health Brunswick Medical Center's Chief Nursing Officer. Welcome back, Jill.
Hi, June. Thank you. It's so great to be here.
I'm so happy to see you. It's been a while. So somebody out there may not have seen your last time that you were here. So let's remind our folks who you are and what you do.
Well, I'm Jill Ward. I'm the Chief Nursing Officer for Novant Health Brunswick Medical Center. I've been here 5 years. I moved here from Charlotte, North Carolina. I actually grew up in the county next door, Columbus County, so I am kind of a local.
I would say that's pretty local.
Yep, pretty local, and have enjoyed every minute being back.
Yeah, it's a great place. We moved here 22 years ago, and I just wish I'd moved here sooner. Tell me where you went to school.
I went to college in Charlotte, graduated from UNC Charlotte.
Yeah.
Been a nurse for 30 years,
Wow.
31 years actually. So,
Yeah, you've been a nurse a long time.
yeah, long time.
And then you transitioned to management.
Yeah, I've been in leadership for probably 20 of those years. So, it's been very exciting career.
The 5 years went really fast, didn't it?
Absolutely. Seems like yesterday, really.
Yeah. And you say you're originally from this area, from Columbus County. So what brought you left and went to Charlotte. What brought you back?
Well, after getting married, my husband is also from Columbus County as well, and our parents are here, so started having those grandbabies and just thought, you know, after all these years, it would just be great to get back closer to home, to have grandparents close by, and also my siblings are here as well.
Oh, really?
Yes.
Oh, well, that's nice. Well, I know that you have been here, like we say, 5 years, and we're coming up on our 10th year anniversary. So with the hospital. So tell me some of your favorite memories of these past few years.
I think for me, just seeing the changes and the services that we brought to the hospital to keep our patients here in the community instead of having to go somewhere else for health care has been some of my favorite memories and most exciting.
Yeah, it's really nice when I talk to people out in the community. They're happy that we've grown and that we are adding new services all the time. They're happy about the new collaboration with New Hanover Regional Medical Center because they're able to stay in their own community for care. And that's what's most important, to be near their families. So I think you're spot on with that. That's probably the most important thing we've accomplished.
Yeah, we've created a lot of new services at Novant Health Brunswick, and you know, we've had a sleep center to open. We're now
that thing it's so busy.
Very, very busy. We stay really full there.
Yeah.
We've been able to add the Da Vinci robotic surgery program.
I think they just got another one, the second one.
Yeah, so it's really growing. We've been able to add 3D mammography, inpatient dialysis, mobile.
Inpatient dialysis is really amazing.
Yes.
Those folks, if they're in the hospital, they can have their dialysis there, right?
Yeah, that's correct. It's been a big, big help to our patients, so they don't have to go travel as far as, you know, to Wilmington or up into South Carolina. So that has been very helpful.
Yeah.
We've also
how about the helicopter?
Yep, we put the Airlink aircraft there to help us be able to, you know, rapidly expedite movement to a bigger facility for our code STEMIs and our, you know, our heart attacks and our stroke patients that come to us, that we can get them out and get them timely treatment.
It seems to be quite busy. I see it taking off a lot.
Yeah, it stays busy.
It stays busy. Yeah. How about infusions? Do you do infusions?
We do. We have started our new infusion center that's been quite busy as well, and we're, you know, just really glad to be able to offer these services to our community.
I heard it's like a club. I heard the same people are getting their infusions and they're seated next to each other and they're just chatting and it's like a social thing.
Yeah, and you get to make new friends.
New friends, they love it.
Yeah.
They love it. How about some of the tele programs? What do you offer?
That's a great one too, June. We have now on campus, we have telepsychiatry, teleneurology, and we also have added, just this year with the pandemic, we've been able to add tele-ICU, which means that we have a critical care doctor in our ICU rooms helping us care for the patients there. So that's been a real big thing for us.
Didn't some racing company make the carts that are in the room for use during? They can talk to the patient, can talk to the doctor. The doctor
absolutely
they
they
can
did
actually examine the patient. Yeah, that's really high tech.
Yes, very high tech.
Yeah, and I read something about palliative care.
We have that service as well on campus.
That's an amazing program.
Yep, and we've also started hospice in place for, when patients are hospice patients, but they are too sick to go back to the facility, to the hospice house. Maybe the hospice house is full. We also offered that as well to be able to take care of those patients.
Yeah. What about cardiac services?
We have added mobile cardiac cath lab to our campus as well.
Yeah, I saw that the other day, and I thought, oh, we're doing cardiac cath.
Yeah.
That's pretty cool. Well, I know that you've received several awards. Let's talk about that.
Yes. Well, this year we are still Leapfrog A hospital.
That's pretty impressive.
Which is a huge accomplishment. Shows our quality is really good. We've also are a CMS 4-star rating, which is also really well. We've also, the American Heart Association has given us a Silver Plus Award for our stroke care with our patients. And we have actually this is our second year with our baby-friendly destination as well.
Oh, that's right.
And just this past year, Newsweek voted us as Best Maternity Hospital for 2020. So
wow, that's impressive.
Been very exciting for our team.
Shelburne and I were talking about the number of babies, and years ago when I first joined, we were birthing like 9 babies a month.
And now we're much higher.
Yeah. Well, it's been a interesting time these past 15 months or so. How's your staff holding up with the pandemic and what have you?
It's been very stressful.
Yes.
A lot of changes, a lot of quick changes, but the staff, I think, have really persevered through all of this. The teamwork has been amazing. They've had to juggle and toss around to create different types of schedules. We have a lot of working moms with the pandemic.
Right.
I don't know. School. Yeah, no school, and we still have to have nurses at the bedside to care for these patients. So we've been very, very creative in what we can allow and have our staff do. And I think it's been good. They're tired. Yeah. It's kind of good to see that we're kind of on a downward trend as far as seeing a lot of COVID patients in the facility. So that's been exciting. But the staff, I've been very proud of our team. All team members at Brunswick have just done an outstanding job.
That's great. Well, before we wrap up, is there anything else you would like to let us in on?
Well, I would just like to say, that I have enjoyed working in this community, love what I do, and love the community that I work in. And the community has also been very, very supportive of us throughout the pandemic as well.
Well, Jill, you and your team are truly healthcare heroes, and we salute you. We could not have done this without you and your nursing staff, so kudos to all of you.
Thank you.
And thanks for being here, and I look forward to seeing you again soon.
Thank you, June.
You're welcome. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novonthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
ATMC TV is your community channel, bringing you the best of where you live. Stories about local people and businesses. Staying fit and living well. Coverage of high school sports. And the area's only local cooking show. Tune in to ATMC TV, your community channel, only on ATMC Cable, Channel 3 and HD Channel 910. Watch online at atmctv.com.